Okay, hello, it's Lindsay here again from the UK Hypnosis Convention team. Today I'm with Linda Bromage. Linda has over 40 years working in the dental profession, 15 years as a hypnotherapist. She has a lot of qualifications, quite a lot to list for me, but she's a PhD researcher in hypnosis as well, an award winner for the Royal Society of Medicine's Psychosomatic section in 2018-19, very recent. Linda's presentation, which is on Friday, the first day of the convention, is called Hypnosis for the Dental Profession. Linda, welcome. Can you tell us a little bit more about yourself and your presentation?
Yes, thank you. Lovely to talk to you again. The last time we met, you put a needle through my hand very painlessly.
Oh, I did. Yes, I think that was the first time I did it, and I was really nervous. So I've always thanked you for doing that, letting me do that for you, Linda, to you.
Now, I'm really excited about having the privilege to talk at the convention this year. It will also be my first visit. Because I'm so passionate about bringing hypnosis to the dental profession. It is a behavioural science that's never been taught, and in fact behavioural science now in all of dentistry is being reduced to a minimum. So, you know, it's something we really need to do. As you say...
Oh, you're going a little...
Are you there? Yeah? Can you hear me? Hello, yes, I'm
yes, you're back again, Linda.
About that, yeah. I got into dentistry training, but for many years I've always worked with anxious and stressful patients without any problem. It's an intuitive connection with people that I've always...
Linda, this connection...
Not good.
Our connection's not very good at the moment. So, it keeps wandering off. Let me see. Let's try again. Carry on, and if it gets it worse, we'll stop for a while.
Okay. Sorry about that. So I was explaining my background, that before I trained in hypnosis officially, I was utilising the skills that I had automatically and intuitively, which obviously would have been more conversational hypnosis. And it was realising that I could do a lot more with this, that I went on to train, did a Diploma, did a BSc, got very interested in research, and things went on from there. I'm very aware that modern dentistry is extremely stressful for the staff. I'm also very aware.
Yes, it can be.
And so they carry stresses. And so my talk is going to be to hypnotherapists who will treat dental anxiety and phobias, and also those to trainers. So that if you're training, you need to know a lot more about the field of dentistry. It's not mentioned in any books, in any good books. And so the big thing too now with anxiety in dentistry is 50% of the population have a dental fear of some kind, and up to almost 30% have a phobia. So there's a great deal of the population that cannot go to the dentist for one reason or another. We also know now that bad dental health is strongly linked to cardiac disease, pneumonia, diabetes, and many, many other things. And so these stressed people are very aware that they need to face the fear and go to the dentist, but they need a great deal of help.
I suppose by knowing all of that, that's more stressful as well, isn't it?
Absolutely. Yes, it is. And if you think about it, if you have a fear of flying, you don't have to fly.
Exactly.
If you have a fear of heights, you don't have to climb a mountain. But you do have to face the fear and go to the dentist.
You do, yes.
And we're all very aware that people don't ring that date in their calendar and think, yippee, 3 more days till I'm going to the dentist.
No.
And so my presentation is really to bring all of the understanding of the nuances of dentistry, how fear affects the person that walks into the surgery, into the door. The minute they're walking through the front door, they're in some stage of anxiety, and it's very contagious. And they'll sit with others in the waiting room, and it is all about affect.
Yes, yes.
And stressed staff will affect the patient. Likewise, the patient will affect the staff. So it's about a lot of being aware of what fear is, what anxiety is. A big part of how we affect one another, talking about mirror neurons here, and the intersubjectivity between a client or a patient, or dental clinician and a patient. And I've always believed that this was where Erickson's power lay. The fact that he was an incredible observer of people, and the fact that you take time and you share their space, you can just by being silent or being in the right place in your mind massively affect the fearful mind.
Yes. Do you know, I hadn't really thought about that, about the sitting in the waiting room with all the people that are nervous. Of course, you know, that's obvious now you mention it. I'd never really thought about that.
Yes, everyone's on hyper alert, you know, almost for full fight or flight.
Yes.
And just by peace and quiet and time and slow brings down, rebalances the autonomic nervous system.
Yeah.
And then you're giving back the patient power, control. It's the fear of loss of control and fear of anticipated pain. And they all come together.
Yeah. And dental surgery is so much better now, isn't it? Pain management and everything. Yes. A bad experience when you were a child probably isn't going to be anything like it, but it's there in our minds, isn't it?
It's there in our minds. And I mean, I've been doing this for so many years, practice very good self-hypnosis. And yet if I'm not mindful, if I hear a shrill drill, I can easily recall a painful root canal that happened a few years ago, if I'm not aware of it. And it's about really being mindful and present in the moment, particularly for dental professionals, and to then, so that they do not affect and add to the stressed person. We've always said in dentistry, if the patient could leave their heads at the door, we'll fix them and then come back and collect them, but they don't. They come with a myriad of emotions.
Oh, yes, if only we could leave our heads at the door sometimes for all sorts of things.
So the presentation is because really I've read massively, and there is nothing helpful or relevant at the moment out there that you can read or you can learn about hypnosis. Most of it is being cut and pasted from many, many years ago in books. And it is so relevant now. So it's a huge niche for for hypnotherapists.
It is.
Who specialise in dental anxiety and phobias. Yeah. And also, hopefully, to train the dental profession. There is very, very few places at the moment that they can get good quality training.
No, I guess so. Because we've had we're working with Adam, and we've had quite a few dentists on our courses, which is really lovely to see. And we know that they are using it in their profession, but that's a drop in the ocean, isn't it?
Yes. I use it every day with my patients, but I won't call it that. And it literally is just the power of the imagination.
Yeah, interesting, isn't it? Because the Hartland's book is a hypnosis for a dental profession as well, isn't it? But is it not really used?
No, it's really old school.
Yeah, well, yes. Yeah.
We've moved on, and we know much more about how bodies work, how mind-body works, how we relate to each other. So So it's a far bigger area, but it's fascinating and very, very doable. Very doable.
Yeah. Linda, thank you so much. And you are actually speaking from your surgery, aren't you?
I am. I open the sea, but today it's a bit stormy.
It is very stormy where I am as well, actually. So you can actually see the calmness of Linda's surgery. So,
and this is my place. Yes.
This is your place. It looks really calming. It really does. Linda, thank you so much. We had a tiny bit of connection problem, but I don't think it's affected what we've had to say. So your presentation is on the Friday, 11:45 to 12:45. I'm really looking forward to it, and looking forward to seeing you again, Linda. And I might bring my needles, see what we can do.
Thank you so much for talking to me.
So much, Linda. Thank you. See you soon.
Bye-bye.